Quick comment on testing. As you know, there's PCR testing, which actually looks for the presence of genetic material of the virus, and this involves sort of putting a nasal swab down your nose and throat and doing sort of a preliminary chain reaction test. There's also antibody testing where they can draw blood and to see whether or not your body has actually developed antibodies in response to the infection that has occurred. Much of the testing that the U.S. government and health policy people look at is the percentage of the tests, PCR tests, that come back positive. And the World Health Organization has come around saying that we want to get at least 5% or below, which signifies that we've got adequate testing to really see whether or not the infection is growing, shrinking, or whatnot. And you can see on the left panel, these are all the states that are describing their percentage of positive tests. Majority of them here are above the 5% line, with a handful here below the 5% line. And then across the world, as you can see, the U.S. in this graph shows the daily number of tests per 100,000 individuals on the x-axis, and the number of these tests that turn out to be positive. And the U.S. by far is performing the greatest number of tests per 100,000 of the population, but is still just above the 5% mark. So hopefully, with a little bit of help and a lot of cooperation with the community, we'll be able to get this bubble below the line and get us to an adequate point of testing availability.